Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. On today's episode, we are joined by Dr Sula Windgassen, who is an accredited health psychologist, chartered psychologist, and cognitive behavioural therapist. She currently works for the NHS in South London and Maudsley NHS Foundation Trust, developing and delivering services in the long-term conditions care pathway for Croydon talking therapies. She has a PhD from King's College London in psychological medicine, and her thesis was based on data from the largest randomized control trial of CBT for IBS to date, the results of which were published in the BMJ and the Lancet Gastroenterology and Hepatology. Her journey into health psychology rapidly evolved from her own experience as a patient experiencing multiple medically unexplained symptoms of a urogynecological nature. On today's episode, Dr. Sula discusses with us stress management during the current COVID-19 pandemic. Hello champions, and welcome to another episode. Today I have Dr. Sula in with us today, and we're going to be talking about COVID-19, why we're stockpiling on toilet paper, and how do we deal with stress in a way that is productive and, less traumatizing. Welcome, Dr. Sula.
Hi, thanks for having me.
Thanks for coming on. So tell us a bit about yourself before we get into the episode.
Yeah, so I'm a health psychologist. I did my doctoral training at King's College London, and I also did a PhD at King's College London. My PhD was looking at cognitive behavioural therapy and why that works for reducing symptom severity in IBS. And now I work for the NHS in improving access to psychological therapies.
That is awesome. Thanks for coming on today. So obviously COVID-19's sort of taken over the world, and it appears to be on every single continent right now. So no one has been spared the significant impacts that it's had on us. How are you coping with COVID-19?
So far, so good. I can't complain. I had 3 days in the house without leaving it, and it didn't feel that bad. But today was my first outing in 3 days, so I really appreciated that. I think I'm just seeing an increase in work as we try and rally around and kind of help out our colleagues in the NHS. So there's an increase in that respect, and I think a personal challenge is from working at home, which we're fortunate to be able to do. It makes it a bit more difficult making that work-home divide. So I guess that's a personal difficulty at the moment, but not too bad really overall.
Awesome. Yeah. And I think it's definitely had an impact on everyone, regardless of sort of the kind of work that you do and what your socioeconomic background has been. So the first question I have is, why did we stock up on toilet paper? It's bothered me for a really long time. I figured someone who studies the mind and understands human behavior might have a decent hypothesis.
So I'm going to make a huge disclaimer that I have no idea from a research point of view, but I guess my hypotheses might be in line with, the taboo around poo, maybe, which we see in IBS a lot, and the kind of horrifying catastrophic ideas that we've got about what it might be like to have the symptom of diarrhea without being able to wipe our bums. Maybe that was a really, really scary thought for people. But it was interesting to me because I didn't even realise that was a symptom, and people really obviously honed in on that. So I wonder if there was a bit of misinformation along the way of that being, a front and centre symptom, and there was a bit of Chinese whispers, and people are really scared of accidents and being caught short. So perhaps there was something in that seemed a lot more violating than than having a fever or something.
Than having a fever. And what kind of things determine a person's response to stress? So what is there anything specific that might sort of be a predisposing factor to how each person then responds to stressful situations?
Again, I don't think there's any one particular markers. Obviously, the broad things that we might expect have an impact and interact with that. So upbringing, how we've been taught to deal with particular crises or just stress in general, that will have a massive impact. Our self-esteem in terms of how well we think, or how able we are to cope with particular things. I think also the interaction of the nature of the threat and our perceived coping responses. So somebody might be really good at coping with a particular type of stress, but then when it comes to health, that seems really scary and out of their comfort zone. So very generally, it's what we perceive our coping and rescue resources to be will determine how anxiety provoking this is and how stressful it is. And also, I guess one of the struggles that we're seeing with this COVID-19 and people's responses, there's a real variation from people taking it really seriously and taking all the measures and maybe more, to people still going out for barbecues in the park. And obviously one of the big disparities there is how bad they perceive the threat to be. And some people will think it's a really huge threat. They'll be thinking of it from all angles. If I don't get it, somebody I care about might. If we don't, then we could infect other people down the line, and that would be awful. Whereas other people might not entertain that and think then that it's that terrible. So I think all those things really play into it.
Into how we respond. And is there anything, so you said something about sort of family backgrounds and that also then determining how we respond to stress, and perhaps our family of origins as well, how they responded to stress, because sometimes I think it's a learned behavior. Is there anything that sort of acts as a protective mechanism in terms of how we've been brought up that then makes us better able to deal with stressful situations when they present?
Again, I'm not hugely familiar with the research on specific upbringing factors that make us better able to respond to stress specifically, but from the wider research, I imagine that how we've seen our parents cope with things are the strategies that we then use, or we have developed alternative strategies where we've seen that that's not been helpful. So I guess those kind of things would kind of impact on how we deal with stress. But stress is such a transient word, it can mean so many different things to different people, and we might be really able to deal with particular types of stresses and less able to deal with others. And that will depend on our previous experiences and how we've been able to face different things in the past, and how we perceive our resources to be, I think.
And obviously working, clinically, what kind of factors do you think contribute significantly to health anxiety?
I think, well, I'm not sure what contributes. I think I'm as a clinician, I'm less interested in what contributes and more what maintains. So I think, we could think of contributing factors might be, again, there is some evidence to suggest that if there's a family history of health anxiety, then you might be more likely to get it. But equally, people can have health anxiety when their parents aren't particularly health anxious. But it's generally a belief or a perception that things would be particularly bad, and that can be accumulated from our environment, from different experiences that we've had. So those generally are things that might contribute to getting it. But what I'm interested in is what maintains it, and what we see in health anxiety. One of the key things, really, from my point of view, is people symptom focus, because it's so terrible to get whatever the focus of the health anxiety is. They tend to focus a lot on their symptoms because it makes sense from their point of view. they're trying to protect themselves. I must monitor this. If this gets worse, then I'll go and see my doctor. But actually what that ends up doing is we do this little behavioural experiment often where we say, can you feel your left foot? And without thinking about it, and people aren't really paying attention to the left foot, and then we give them an opportunity to just really think about your left foot now. What does that, what's going on there? Can you feel anything? And 99.9% of the time people start to feel symptoms they didn't feel before.
I can feel something now, actually.
Yeah, exactly. I can feel mine. So that's exactly what goes on when people symptom focus. It's showing the mind, oh, there's something going on here that you want to pay attention, so we get more feedback. And that really exacerbates, as you can imagine, the whole health anxiety, because we're getting more feedback, then the mind's catching on, oh, there is something there. So then we have to focus more, and it just goes round in this cycle. And I think I would pinpoint one of the biggest challenges in health anxiety is the symptom focusing, but there are other kind of maintaining factors too.
Okay, and what other sort of maintaining factors perpetuate health anxiety?
I suppose safety behaviours is a huge one. So we always give this example of, if you use particular safety behaviours, if I think that I'm gonna catch a sickness bug and it's going to be really, really terrible and evolve into something, lifelong or whatever it might be, then I might go out of my way to rinse every surface I come in contact with, use all that antibacterial hand gel, etc., all these measures designed to keep me safe. But it means that I never get the opportunity to see that actually without using it I'm still not sick, and that worst case scenario doesn't happen. So it feeds into this assumption that you need to keep doing it, so that maintains the anxiety. Oh my gosh, if I'm without my hand gel one time, I might really be in trouble. So safety behaviors, and they can be really, really subtle ones. They might not be ones that people think will completely get rid of the problem, but just even asking reassurance all the time, if we rely on that a lot, then that means that we're not seeing for ourselves that we can move our attention away and we're absolutely fine. So I guess that's another key one. And then really the thoughts about getting symptoms and what that would mean. Often we're kind of working in therapy to try and help people look at it from a different perspective and build up the ideas that the risk isn't as likely, and should something happen, they would have the ability to cope with it. It might not be great, and it wouldn't be what we would wish, but should that happen, you would have the resources to cope with it. So I guess those are the key things, really.
Okay. And how do you encourage someone into then understanding that actually you do have the resources to cope when they feel like in this COVID situation, so many people feel helpless and they feel out of control? How do you then get an individual back to a point where actually you are able to cope with it if this does happen?
Yeah, I guess with I guess it would differ actually slightly with general health anxiety around a specific topic. We might consider particular scenarios and use imagery even, what would that be like? And if we think about it, what would happen? And, even going down the line to how would other people respond if, it kind of follows the line of even death anxiety sometimes. That's at the heart of health anxiety. So we try and work around making that a less scary prospect, which takes a lot of individual kind of work. But I think with getting very anxious about COVID right now and this pandemic is really, really understandable. And I think actually the resources to cope might not be there initially, but we can definitely research what helps us to cope in this pandemic. And I think stress management is a real key one, and that involves a whole range of things, and you can work out what works best for you.
Okay. And what sort of key tools for stress management, or in terms of, because a lot of these things are normally tailored to the person as well in terms of how they're actually responding, but what are the key messages that we need to get out to people to actually understand how to deal with the stressful situation that we're all in at this point?
Absolutely. I think The first thing is really to try and help our mind out by creating some nice stability.
Okay.
Give it less to kind of latch onto and less uncertainty that it's got to cope with. So just having a routine, which actually can be a lot harder if you are working from home, or if you've been furloughed, or if you've lost your job. It's so important to sit down and really intentionally think about, what do I want to be in my routine? What are key cornerstones going to be in the day that will keep me kind of ticking over? And what are some things that I can look forward to in that routine? You know, it doesn't all have to be housework and trying to be extra productive and things. It might be a nice bath, or batch cooking meals if that's something that you enjoy. Also, once you've got that routine in place, I think making sure that you've got a good sleeping ritual, so that that's not going out of the window. Again, when we're not leaving the house as much, we have less of those natural cues that cue us into what time of day it is and when we should be going to sleep. And also our screen time will be a lot higher, because that's how we're communicating with people. So try and just input things like an hour before bed, not having any screen time, maybe reading a book instead, or listening to some music, and winding down for the night. Having, again, that strict schedule-ish for wake times and sleep times, and trying to keep that for the weekend. You're allowed to lie in, but try not to let that overrun too much, because again, we're trying to keep the body in a nice rhythm to help the mind. I think over and above routine, our mind is looking for things to problem solve, because it keeps detecting threat. So I think helping the mind out again in terms of trying to identify what is within our control and what's out of our control. Sometimes it can be really, really useful to categorize worries. So I like to help think about worries in 3 categories. One is hypothetical future worries, so they haven't yet happened, they're not happening in the present. One is a present worry, but it's outside of our control. So my neighbours caught COVID, well, we can't do anything about that. And one is it's within our control and is a present worry, so we can do something about it. The first 2 are out of our control. We could think of hypothetical solutions, but there really is no benefit if we don't know whether it's come to pass or not. And it's happened and it's outside our control, and we've had a little think about it, and there's nothing we can do. We're just doing ourselves more harm kind of thinking it over, and we're making things, really difficult for ourselves. So when we've identified, okay, the worry fits into one of these 2 categories, then it's time to do something else. And sometimes it's really difficult to think about other things if we're just sat there. So it might be that we would instead, do something different that can involve our mind and take our engagement. And that might be watching TV or a movie for a bit of escapism. It might be reading a book, it might be cooking or doing housework, whatever works, and it might be different things for different times of the day or different moods. So helping ourselves out in that way. And then if it is something that we've identified that we can do something about, then making a plan and deciding when we can start the action towards that plan. It might not be straight away, it might be the next day, and just scheduling it in. And then we know, okay, tomorrow that's getting dealt with. In the meantime, if I worry about it, it's not going to help me out at all. So it's licensed to disengage again, and then go and choose something else to do that's going to be nourishing for you.
And that's really interesting. And does that apply as well to sort of symptom-focused anxiety? So are we then, and how can we address symptom-focused anxiety in terms of people honing in on like the diarrhea and the toilet paper, or the coughing, the fever, those features of COVID?
How so? Like, have you got an example?
So in terms of, if let's say, so in symptom-focused anxiety, where people have health anxiety and they're focused on, whether it's the pain or the headache. So in COVID-19 situations where people are So it is a worry that I could get it. I don't have it now, but I could get it. And so every single time my child coughs, I look at them twice, or every single time I have a tickle in my throat, you know, it raises my anxiety levels. Is there any way that we can sort of try to divert that in the same way you talk about worry management?
Absolutely. Yeah, I think it absolutely applies there. You know, if my child's coughed, is there anything I can do about it in this present moment that's going to prevent anything from happening? And really thinking about that, you know, do I need to call my GP? Would the GP be able to do anything? Probably not at this stage. So here's the choice. I can either really obsess over it, worry over it, and hone in on any cough or lack thereof and cause a lot of stress for myself and for my child, or I can just kind of see how it plays out, and in the meantime enjoy some company with my child or doing something different. So yeah, I think it absolutely does apply. Obviously it is difficult, and it takes some practice, but that's where you can make it easier on yourself if you preemptively perhaps write a list of different activities that do help you disengage from thinking, just generally, not doesn't have to be worried thinking.
Yeah. And in terms of COVID, so I think there've been quite a lot of motivational speakers talking about how everybody really ought to use this lockdown period to, you know, write their book, or, you know, finish writing their plays, and, you know, get a grip on their lives and, you know, become extremely productive. But I always feel as though sometimes that might be destructive for some people. Is that accurate?
Yeah, I think so. I agree with that completely. I think everybody deals with stress and potential threat and uncertainty very differently. And also the effect of lockdown, it might not be stress. People might not be particularly worried about COVID, but actually they're not seeing their family, they're not seeing their friends. They live in a house that's, you know, a flat share or something, and they don't particularly get on with their housemates. So there's a whole range of factors that can affect how we feel with the new measures of lockdown. So to assume that everybody's suddenly got free time and energy and creativity to yeah, as you say, kind of sort their lives out or be the next big author, it's not really fair. And I think acknowledging the effect that the current situations are having on us is more important, and that might change, and acknowledging that too, you know, one day might be better than another, and that's quite comforting, because then when you are having the bad days you can see, well, actually 2 days ago it was a bit better, so just because I'm having a bad day now doesn't mean it's going to keep being like this.
I suppose putting things in perspective as well, and just trying to acknowledge the good bits also helps us, you know, with gratitude as well going forward. And I was going to say something as well about isolation and how the lockdown, you know, causes people to be isolated. And obviously with anxiety and depression, isolation is sort of what we normally refer to as a red flag, or something that we get concerned about when people have anxiety related illnesses or living with depression. How would you encourage people to deal with the isolation that's being enforced on us currently?
I think we have to get really creative, and that's the difficulty if you do have depression or low mood. Even if you don't really, it can be really difficult to think creatively. So seeking support first and foremost if your mood is low. Like I say, the improving access to psychological therapies, which is nationwide, the doors are still open. They're taking remote appointments. You can still get the help there, and so that help is really, really useful to help come up with some creative ways to not be isolated, and also to give you a bit of enthusiasm maybe about them, because sometimes you see them written on paper or on a website, like, yeah, but no, not for me. Whereas if you think about the logistics, or, you know, how it might work or how it could be tweaked so it's something that's palatable to you, and you're encouraged to just try it out and see, then it could be something that actually makes you think, actually this is quite good. And one thing that I've noticed, a personal kind of benefit during all of this, I've got really close friends across the country, and I hardly ever speak to them or get to see them. And now what's been really nice is, you know, everyone being forced in the same situation, everyone is reaching out for using video calls or FaceTime or just phone calls to keep in touch. So it feels like everyone's available, so that the connections are there. You know, it's not the same as when everyone's out and having a social life and you're isolated. People are more likely to pick up the phone and more likely to want to hear from you. So maybe it's licensed to try out getting in touch with people on different mediums, I would say.
And that's great. And what do you think? So obviously the way the lockdown's gone, it's definitely changed the way we interact with each other as well. And I think it's also changed the things that we prioritize as well, the things that we feel are actually important. Do you think that this is going to significantly change how we live and interact with each other going forward once it's all over?
I wonder, I think there was a bit of research saying that it would, you know, even things like the handshake might be phased out after this, or it might take a while to come back. Yeah, I can't say, I can't call it, but what I'm hoping is some of the beneficial things that are starting to emerge from this, the acknowledgement of how important social connection is to us. Hopefully that is something that is prioritized and thought about a bit more explicitly as we go forward, and also, I guess, you know, giving people the license to be more sociable, but in a smaller quantity, because I think sometimes it's a real barrier, especially in London. You know, everybody lives all over the place. It's such a mission. And then people don't go out and do things sometimes, or they'll do it like once a month. Whereas now we've all seen that it works to have a house party for an hour and have to leave. So I think those are quite nice aspects that might stay. I think also, perhaps you mentioned gratitude before, you know, honing in on the small things that really make us tick. That's something that we're having to do now to really adapt to this, so that we don't, you know, go crazy just being confined in one space a lot of the time. And that's a really important kind of thing to do just generally in life. It's been associated with increased psychological flexibility, increased optimism, better health outcomes. So the more we can practice that now when we have to, the more likely we're going to retain that going forward, and that's going to do us good, really.
And you mentioned something about optimism as well, in terms of gratitude and, you know, psychological flexibility and stability as well. In times of stress, we often have sort of either the pessimist, the optimist, and then people who are somewhere in between. Does optimism in this situation, in this current sort of climate that we're in, how does that relate to stress? And do you feel as though excessive optimism can be a negative in stress management?
I think with relation to stress, optimism probably never is a negative, as far as I can really think about. It might, you know, if we're overly optimistic, we might not foresee particular risks or
dangers,
things. But generally, we don't find that optimists are huge risk takers. So I think optimism is a real protective thing. We don't have to. I think there was some debate about whether, you know, these traits of optimism, extroversion are actually very valid anymore, because we're finding that these traits aren't as stable and enduring, and they might be different in different circumstances and change over time and things like that. So I think we can all, you know, be have qualities of all of them in different shapes and forms, and we can definitely teach ourselves to be more optimistic through kind of what we do with our attention, paying attention to the weather when it's really nice, and really, you know, sitting with enjoying that cloud display or something like that has a positive effect on our mind, and we really kind of encode that information, and then that has a knock-on effect on our mood and so forth.
And I often find that groups of people, and also the people that you surround yourself with as well, often have a role to play in terms of how you think and how you perceive things, and whether or not you're prone to pessimism or optimism. So what kind of advice would you give someone in this situation who perhaps is surrounded by a group of people who only think the worst and are sending out conspiracies, and they don't want to dwell on those conspiracy theories, and they want to look for hope? What kind of advice would you tell them about changing their environment?
Yeah, I think that's a real difficult one, because it really depends, doesn't it? Because sometimes it depends if these people are family that we can't opt out of necessarily from the WhatsApp groups and whatnot, or our main circle of friends. I think if we have got a bit of an option and they're more acquaintances or distant friends, we can mute them for a little while so it doesn't have a penetrating impact on our own mood and anxiety levels. If it is people that we're closer to and we want to keep in touch with them still, I think now is the time where we really need to consider being assertiveness. This is one of the things that I work with clients on quite a lot, which it's not a very British thing, and we think of assertiveness on a spectrum. So there's kind of passive, which ends up as passive aggressive, and then on the other end there's aggressive, which is obviously not good either, and in the middle is assertive. So it's the ability for us to assert our own needs in a really reasonable way and with good communication. So I think it's well within our right to reflect back to the group the impact that kind of information and chat has on us, and it's really reasonable to say, at this time I'm feeling really anxious and I'm unable to cope with these messages. If you want to share these things, is it okay if we make a separate WhatsApp group or something so that you can do that, and then we can have this group for just keeping in contact and see how people respond to that. And sometimes people are flippant and whatnot, but there's this parrot technique where you just keep saying the same thing until people really hear what your needs are, because I just think that's really important. There's no need to have to withstand anxiety provoking information all of the time. And actually we worked out something with our own kind of family WhatsApp group, which was we can do news updates just after the PM speech or the government speech at 6:30, and then from then we don't have it in the group anymore. And that's really
a great
well.
idea. I'm sure that would work really well, because it limits how much information, and you can avoid it at that specific time. Is there something about stress and sort of chaos and upheaval that causes us to lean towards anxiety provoking information, conspiracy theories and things like that? Is there anything, sort of an explanation or a hypothesis again as to why that happens?
I don't know about conspiracy theories. I know if we're stressed or worried, just like when we were talking about the safety behaviours, one of the key safety behaviours in health anxiety is to Google, because you want to get as much information as possible. Google tell you within 2.5 seconds that you've got cancer.
It actually will. Or brain tumour. Yeah.
Oh yeah, exactly.
Yeah, definitely. All the time.
So that is, it's meant to be a protective thing. We're trying to gather information, and what tends to happen is the more information we search for, the more anxiety provoking information we find. That's just the way it works when we're looking into scary areas of information, like around a pandemic or whatnot. Maybe with conspiracy theories, it's comforting. Again, maybe it's a protective thing. If it's a government conspiracy and there's not a real threat, then it feels a bit more manageable or whatever. So that would be my hypothesis. But then, saying that, I think about conspiracy theorists about the flat earth, and I just don't understand that at all.
Exactly. There's just so many out there, so I don't know how they come about them. But someone was saying something really interesting. I got an email from a business network, and they were talking about how people's exes from previous relationships are now sort of working their way back into lives and things. Is there something about this lockdown and this isolation that then causes people to yearn for relationships that are decades old, even toxic ones?
I guess that makes sense to me, especially if people are considering lockdown on their own and they're currently single. To yearn for an ex makes perfect sense. We can rose tint the past, thinking about how great it would be if we were only there with such and such for a great time. So that does make huge sense to me. And maybe there's something about thinking about mortality, the death rates rising and people get worried about that, and it makes them think about their lives and their decisions. So maybe there's something in that too. Yeah.
And how would you then encourage people to then address those situations, and not then fall into the traps that they come out of in the past, or then potentially get into more dangerous patterns now?
Yeah, I think again it comes down to acknowledging what your experience is. I think we're very good at being ruled by our automatic brain, which is kind of doing calculations in the background all the time that we're not necessarily aware of. So we might not know that we're yearning for an ex for particular reasons, or that's hugely driven by a desire just to have some company, and we might think that we're coping quite well, but we're relying on something quite heavily. So I think checking in with ourselves. What I do find is really useful to acknowledge things is to journal. It's not for everybody, but I think putting pen to paper and not filtering what you write, just asking your questions. How do you feel? What's on your mind? What's worried me recently? What's the thing that keeps coming up? Those questions can really prompt some awareness that we might not have had before. And then once you've got that awareness, then you've got more of a choice on how you want to respond, and you can work through things a bit more logically. Do I really want to get back with such and such? These are the pros, these are the cons, and then you've got a bit more of an insight, rather than trying things automatically without thinking them through necessarily.
Thinking them through. And in times of peace, or because they've described sort of COVID as almost a sort of wartime living to a certain extent, but in times of peace and stability, work is fine, you're able to go out freely, and dealing with stress at those kind of times, so work stress or home related stress, are we encouraged to manage stress in the exact same way that you've described, sort of separating it into sort of hypothetical and actually likely to happen as well?
Yeah, I guess the hypothetical, separating out into those categories works really well for generalized anxiety and worry.
Yeah.
Stress, again, is such a huge term because it can be used to describe so many things. Stress, like you say, it could be work stress, it could be home stress, it could be arising from particular situations. So again, I think first acknowledging what it is that's causing you stress, and if that is, that could be generalized anxiety about lots of different things, or it could be a work situation that needs resolving. It could be a whole heap of things, or that life's really stressful. So I think the first step would be to work out what the stress is, and what the difficulty is in managing that, and then from there making decisions about what's the best step. Sometimes it can be resolved by doing something practical, but other times you can use those controllable versus uncontrollable. But I think it is true to say having a routine really helps us out and gives us that stability. Sleep is hugely important for our health and our mental health, so having a good routine there is great. And I suppose the kind of underlying theme of all of this discussion is tapping into what is on our minds, and some of us are really good at doing that, but generally I think as humans we're not. Our brain just takes over automatically, and we can be on autopilot quite a lot of the time. So giving ourselves permission just to check in there, but sometimes that's easier said than done, because it might feel like that's a really scary thing to do. So seeking help as well if it feels like it's not something we're equipped to do on our own.
And I was actually just going to talk about that as well, in terms of seeking therapy, practicing mindfulness, things like that, and obviously there's often people who feel that actually, no, I don't want to talk about my problems. I don't want to talk to a stranger about what's going on. Or maybe they've not had any personal encounters of the benefits of talking therapies, especially. What would you say to that sect of people that do need therapy but have these barriers to actually accessing it because of their strongly held beliefs?
I guess I'd be interested. What is the reason behind not wanting to go for therapy? Often that might be a sense of shame or feeling it's a sign of weakness. There might be these pervasive stigma ideas about what it means to go and see a therapist, and whether that means we're really mentally unwell or not. My personal view is that therapy is helpful for everyone. It just is a matter of finding out which is the right one for you. So I'd be curious, first of all, to get them to inquire, what are my concerns, and then seeing if they can look at it from any other perspective. Would they have these views about therapy if it was somebody else? And if they heard that therapy had the potential to be really useful, and that lots of people had found that it did help their depression, or it helped them manage a really difficult situation at work, or whatever it might be, what would the benefit be of not trying it at all versus trying it, even if they see that, no, it wasn't for me at the first place? Surely you stand to gain rather than something to lose.
And something to lose. That is great. That is awesome. Thank you so much. That has been fantastic. Could you just give us a championship point, something for people to take home bite-sized?
Yeah, I think keep a routine and a healthy sleeping pattern. Try and work out what is within your control and what is outside of your control, and use activities that can help take your mental energy and engage you to help manage stress, and do ask for help if you need it.
Awesome. And do you recommend any of the mindfulness apps? Are there any apps that you recommend in terms of helping mental health?
My favorite one is one called Meditation Studio app. I don't know, though, a disclaimer, because I practice mindfulness a lot, whether I like it because it's deepening my practice. So good beginner apps might be Headspace is absolutely fine. It's a good taster. And somebody told me about Insight Timer as well, but I haven't used it. But I think there's a lot of free meditations on there. So any of them really, it all gives you an insight into working with your mind. And as long as the message in the mindfulness apps are to pay attention with kindness and gentleness, then you're on the right lines.
That is awesome. Thank you so much for coming on today.
You're welcome. It's been a pleasure.
Thank you for joining us on today's episode. Do share this podcast with 2 people who have not heard about us before. Remember that this podcast in no way replaces advice from your own doctor or physician. Do subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And do join the club at asliceofhealth.club and drop us some suggestions or questions that you might have. Don't forget to be a health champion wherever you go by separating health fact from health fiction.